Hello everyone, I'm so glad to be with you again in today's video. The topic we'll be exploring today is something very important for older adults and their families: Alzheimer's and dementia. Alzheimer's is a disease that not only affects memory but also completely changes the way the patient interacts with the world around them. Each year, more and more elderly individuals face this condition, and it's not just the patients who suffer, but their families as well. For those who care for a loved one, watching someone who was once a strong, stable presence in the family slowly forget precious memories, lose recognition of familiar faces, or even forget their own family members is an incredibly difficult experience. And it's not just the person with the disease who suffers, it's the emotional toll on those caring for them as well. Alzheimer's is not a normal part of aging. It's a progressive disease, meaning that its symptoms will worsen over time, causing the person to lose cognitive abilities, thinking skills, and the ability to perform daily tasks. It's not just the patients who are affected by this, but the entire family, who must adjust to major changes in their lives, from helping with basic needs like eating and sleeping to managing communication and daily interactions. In this video, we'll explore Alzheimer's, from identifying the early warning signs to the most effective treatment options available today. I'll share ways to care for those with the disease in a compassionate and effective way, because love and patience are key to making patients feel safe and peaceful throughout their journey. We'll also look at risk factors and prevention methods, so we can protect our health and that of our loved ones from this devastating condition. So, what exactly is Alzheimer's? How can we identify its symptoms early, and how can we care for someone with the disease in the best way possible? These are the questions I'll be answering as we move forward in this video. Let's dive in and learn more right now. Alzheimer's is an incredibly cruel disease, stripping away not only memories but also eroding relationships and family bonds. However, if we can identify the disease early and implement proper care, patients can still lead a meaningful and fulfilling life. More importantly, we need to create a space filled with love, patience, and deep care, so they feel they are still an important part of the family, despite the challenges they face. What is Alzheimer's? Alzheimer's is a form of dementia that significantly affects the brain, leading to memory loss, cognitive decline, and difficulties in performing daily tasks. It is a progressive disease, meaning the symptoms worsen over time. Alzheimer's is not a normal part of aging, even though it typically appears as people grow older. The most prominent feature of Alzheimer's is short-term memory loss, for example, forgetting recent events, misplacing objects, or forgetting the names of familiar people or places. Other common signs include difficulties in finding the right words, struggling with planning and problem solving, and challenges in completing simple daily tasks. One of the key characteristics of Alzheimer's is the buildup of amyloid plaques and tau tangles in the brain. These abnormal structures damage brain cells and disrupt the communication between neurons. This causes cognitive abilities to decline, affecting memory, reasoning, and eventually the ability to care for oneself. Common symptoms of Alzheimer's include memory loss. Patients will forget recent events, such as conversations or appointments, and may struggle to remember the names of loved ones or familiar objects. Communication difficulties. Patients may find it difficult to express themselves or understand what others are saying, often losing their train of thought or repeating words. Decline in cognitive function. This includes difficulty with planning, problem solving, and managing finances or everyday chores. Behavioral and emotional changes. Individuals may become easily upset, anxious, or depressed. They may also exhibit confusion or irritability as the disease progresses. Emotion. Alzheimer's is a heartbreaking disease, not only for those diagnosed but also for their families and loved ones. It can be devastating to witness someone you care about gradually losing their memory and the ability to engage with the world as they once did. But it's essential to remember that the person with Alzheimer's is not intentionally forgetting or withdrawing, they simply cannot control the changes in their brain. Understanding this and approaching the situation with patience and compassion can help ease the emotional strain for both the patient and their family. Recognizing the early signs of Alzheimer's is crucial because early intervention can make a difference. Though there is no cure, the earlier we diagnose the condition, the better we can manage the symptoms and improve the patient's quality of life. Alzheimer's may be an unrelenting disease, but if diagnosed early and managed with proper care and support, patients can still live a meaningful and comfortable life. The key to helping those affected is love, understanding, and creating an environment where they feel safe, supported, and valued throughout their journey. Causes and risk factors. Alzheimer's disease is a complex condition, and while researchers are still working to fully understand it, several key factors have been identified as contributing to its development. The causes of Alzheimer's are not fully understood, but we do know that a combination of genetic, environmental, and lifestyle factors can increase the risk of developing the disease. Genetics and family history. One of the most significant risk factors for Alzheimer's is genetics. If someone in your family has been diagnosed with the disease, your risk may be higher. There are two types of genetic risk factors: early onset Alzheimer's. This is a rare form of the disease that can develop in individuals as young as their 30s or 40s. It is typically associated with mutations in specific genes, such as the APP, PS1, and PS2 genes, which lead to the production of abnormal amyloid plaques in the brain. Late onset Alzheimer's. This is the most common form of the disease, typically affecting people over the age of 65. The primary genetic risk factor for this form of Alzheimer's is the presence of a gene called APO4. Having one or more copies of this gene increases the likelihood of developing Alzheimer's, though it does not guarantee it. Environmental and lifestyle factors. While genetics plays a role, environmental and lifestyle factors also significantly impact the risk of developing Alzheimer's. Here are some key factors: heart health. Conditions that affect heart health, such as high blood pressure, high cholesterol, and diabetes, also increase the risk of Alzheimer's. The brain relies on healthy blood vessels to deliver oxygen and nutrients, so cardiovascular health is directly linked to brain health. Head injuries. Individuals who have experienced severe head trauma or concussions, particularly repeated injuries, are at higher risk of developing Alzheimer's later in life. Protecting your head through safety measures and wearing appropriate protective gear is essential. Lack of physical activity. Regular physical activity is crucial for maintaining brain health. A sedentary lifestyle, on the other hand, increases the risk of Alzheimer's. Exercise increases blood flow to the brain, reduces inflammation, and supports the growth of new brain cells. Poor diet. A diet high in saturated fats and sugars can contribute to Alzheimer's risk. On the other hand, diets rich in fruits, vegetables, whole grains, and healthy fats, like the Mediterranean diet, are thought to protect brain function and reduce the risk of cognitive decline. Social isolation and mental stimulation. Engaging in social activities and keeping the mind active through learning and problem-solving tasks can reduce the risk of Alzheimer's. Isolation and lack of cognitive engagement, on the other hand, increase vulnerability to the disease. Age and gender. Age is the most significant non-modifiable risk factor for Alzheimer's. The older you are, the higher the risk. While Alzheimer's can affect individuals at any age, it most commonly affects those over 65. Additionally, women are more likely to develop Alzheimer's than men, with nearly two-thirds of Alzheimer's patients being women. Researchers believe that hormonal differences and the longer lifespan of women might contribute to this disparity. Understanding the factors that contribute to Alzheimer's can be overwhelming, especially if it runs in the family or if we are facing the disease ourselves. While we cannot change some of the risk factors, such as age or genetics, there are many aspects of our lifestyle that we can control. By maintaining a heart-healthy lifestyle, staying mentally and physically active, and nurturing social connections, we can significantly reduce the risk of Alzheimer's and other cognitive diseases. It's about making conscious choices every day that benefit both our body and mind. Symptoms and stages of Alzheimer's. Alzheimer's disease progresses over time, and its symptoms can vary from person to person. However, there are general patterns and stages that most individuals experience as the disease advances. Recognizing these stages early can help caregivers and family members provide the best possible care and support. Early stage, mild Alzheimer's. In the early stage of Alzheimer's, symptoms are usually mild and may be easy to overlook. The individual might still be able to live independently, but there will be noticeable changes in memory and cognitive function. Common symptoms in early stage: short-term memory loss, forgetting recent conversations or events is a hallmark of this stage. They may misplace items or forget appointments. Difficulty finding words. The person might struggle to find the right words during conversations, frequently pausing or substituting the wrong words. Difficulty with planning and organizing. People in the early stage may struggle with tasks like balancing a checkbook, following a recipe, or keeping track of important dates. Getting lost in familiar places. An individual may forget where they are or how to get home, even in places they've been for years. Middle stage, moderate Alzheimer's. As Alzheimer's progresses to the middle stage, the symptoms become more severe and disruptive. The person may need help with daily activities and may have difficulty communicating or recognizing family members. Common symptoms in middle stage: increased memory loss. Memory problems become more noticeable, with people forgetting personal history or important events from the past. Confusion and disorientation. They may become confused about time, place, or the identity of people around them. They might forget where they live or the year. Difficulty with daily tasks. The individual may need assistance with basic daily activities like dressing, bathing, or preparing meals. Behavioral changes. Increased mood swings, anxiety, and depression are common. People in this stage may also become paranoid or suspicious. Poor judgment. There can be a noticeable decline in decision-making abilities, which may lead to poor financial or personal choices. Late stage, severe Alzheimer's. In the late stage of Alzheimer's, individuals become fully dependent on others for all daily activities. The person may lose the ability to communicate effectively and may no longer recognize close family members. Common symptoms in late stage: severe memory loss. Most long-term memories are lost, and the individual may forget the names of close family members or even how to eat or walk. Loss of physical abilities. People in this stage may have trouble swallowing, sitting up, or moving. They may become bedridden and need assistance with all physical care. Loss of communication. The ability to speak or understand language diminishes significantly. Many individuals in the late stage are unable to form coherent sentences or may stop speaking altogether. Increased susceptibility to infections. Due to their weakened immune system and inability to move or communicate, people in this stage are more vulnerable to infections such as pneumonia or urinary tract infections. In the final stage of Alzheimer's, the person's body becomes physically weaker, and they require full-time care. The disease affects the brain to the point where essential functions such as breathing and heart function begin to fail. The progression of Alzheimer's can be incredibly heartbreaking for both the patient and their loved ones. Watching someone you care about slowly lose their independence and cognitive abilities is painful, but it's important to remember that during every stage, they still need love, patience, and care. While the symptoms might worsen, the emotional connection we share with them remains crucial. Understanding the stages of Alzheimer's helps us prepare, provide better care, and make their journey as comfortable and dignified as possible. It's not just about managing the disease, it's about continuing to love and support them throughout the entire process. Diagnosing Alzheimer's disease can be challenging because the symptoms often resemble those of other conditions. However, early diagnosis is crucial for managing the disease and improving the quality of life for both the patient and their family. A proper diagnosis involves a thorough assessment by a healthcare professional and may include a combination of medical history review, physical exams, cognitive tests, and sometimes imaging studies. Steps in diagnosing Alzheimer's: medical history and symptoms review. The doctor will begin by asking about the patient's medical history, any changes in behavior, memory, and cognitive abilities, and whether these changes have been noticed by family members or friends. They may also ask about the patient's family history of Alzheimer's or other neurological conditions, as genetics can play a significant role in the disease. Physical and neurological examination. The doctor will conduct a physical exam to rule out other conditions that might cause similar symptoms, such as vitamin deficiencies or thyroid problems. A neurological exam may include checking reflexes, coordination, muscle strength, and eye movements, as these can offer clues about brain function. Cognitive and neuropsychological tests. Cognitive tests help evaluate memory, problem-solving abilities, and other cognitive functions. Common tests include Mini-Mental State Examination, MMSE. This is a brief test that assesses cognitive function, including orientation, attention, memory, and language abilities. Montreal Cognitive Assessment, MoCA. This test also evaluates cognitive function, including memory, language, attention, and visuospatial abilities. Clock Drawing Test. The patient is asked to draw a clock, which helps assess visual, spatial, and executive function skills. Imaging studies. Imaging tools, such as MRI, magnetic resonance imaging, or CT, computed tomography, scans, can be used to check for brain abnormalities that might indicate Alzheimer's or other conditions affecting the brain. MRI scans can help detect shrinkage of the hippocampus, a key area of the brain involved in memory and learning, which is often affected in Alzheimer's. Additionally, some doctors may use PET, positron emission tomography, scans to detect amyloid plaques in the brain, a hallmark of Alzheimer's disease. Blood tests. While there is no definitive blood test for Alzheimer's, certain tests may be performed to rule out other conditions that could mimic Alzheimer's symptoms, such as infections, anemia, or thyroid issues. Early diagnosis and its importance. An early diagnosis is essential for several reasons. Treatment options. Early diagnosis allows for the use of medications that may help slow the progression of symptoms and improve the quality of life. Planning for the future. It provides an opportunity for individuals and families to make important decisions about future care, living arrangements, and legal matters while the person with Alzheimer's can still participate in the decision-making process. Access to support. Early diagnosis opens the door to support services, such as therapy, caregiver resources, and support groups, which can greatly benefit both the patient and their loved ones. Getting a diagnosis of Alzheimer's is never easy, and it can be filled with anxiety and uncertainty. However, an early diagnosis can provide both the patient and their family the tools to better manage the disease, make informed decisions, and access crucial resources. While the news may be difficult, it also brings the possibility of a more controlled and compassionate journey. As caregivers, the best thing we can do is face the diagnosis together, stay informed, and focus on providing the best care possible while embracing each day with love, patience, and understanding. Treatment and care for Alzheimer's patients. Although there is currently no cure for Alzheimer's disease, there are several treatments and approaches that can help manage symptoms and improve the quality of life for both the patient and their caregivers. Early intervention and a combination of medication, lifestyle changes, and supportive care can make a significant difference in managing the disease. Medications for Alzheimer's. There are two main types of medications that are commonly prescribed for people with Alzheimer's: cholinesterase inhibitors. These drugs help increase levels of acetylcholine, a neurotransmitter involved in memory and learning, which is usually low in people with Alzheimer's. Examples include Donepal, Aricept, rivastigmine, Exelon, galantamine, Razodine. These medications can help reduce symptoms or slow down the progression of the disease in the early to moderate stages. They may help with memory, awareness, and the ability to perform everyday tasks. Glutamate regulators. Memantine, Namenda, is a medication used in the moderate to severe stages of Alzheimer's. It works by regulating the activity of glutamate, a neurotransmitter involved in learning and memory. Memantine can help improve memory and cognitive function, and it is often used in combination with cholinesterase inhibitors. Other medications. Some patients may be prescribed medications to help manage symptoms such as anxiety, depression, or aggression. These include antidepressants, antipsychotics, and anxiolytics. However, these medications must be used with caution as they can have side effects and may not always be effective. Non-pharmacological treatments and lifestyle changes. While medications are essential in managing Alzheimer's symptoms, non-drug treatments and lifestyle changes play a crucial role in improving quality of life and slowing the progression of the disease. Cognitive stimulation and mental exercise. Engaging the brain through mental exercises, such as puzzles, memory games, reading, and word games, can help keep cognitive abilities sharp for longer. Encouraging a loved one to participate in activities that stimulate the mind helps maintain brain function and reduce cognitive decline. Physical exercise. Regular physical activity is beneficial for the overall health of the body and brain. It improves circulation, reduces stress, and helps maintain mobility. Exercise also promotes the release of chemicals that protect brain cells, reduce inflammation, and support neuroplasticity, the brain's ability to form new neural connections. Dietary changes. A healthy diet is essential in managing Alzheimer's. Diets rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, such as the Mediterranean diet, are linked to a reduced risk of cognitive decline. Omega-3 fatty acids, found in fatty fish like salmon and in supplements, have been shown to have protective effects on the brain. Sleep management. people with Alzheimer's often experience disruptions in their sleep patterns, such as insomnia or waking up frequently during the night. Maintaining a consistent sleep routine, limiting caffeine, and creating a comfortable sleep environment can help improve rest. Better sleep can positively affect cognitive function and overall well-being. Social engagement, social isolation can contribute to depression and a decline in cognitive function. It is important to keep Alzheimer's patients engaged with friends, family, and the community. Activities like going for walks, attending group exercises, or participating in support groups can help maintain social connections and stimulate mental health. Creating a safe environment. As Alzheimer's progresses, patients may experience confusion, disorientation, and wandering. It's important to create a safe living space to prevent accidents. Remove any hazards from the home, such as sharp objects or tripping hazards, and consider installing locks on doors to prevent wandering. Having clear labels on items and using simple, consistent routines can also help them feel more at ease. Caregiving and support. Caregiving is one of the most important aspects of managing Alzheimer's, and it can be both rewarding and emotionally taxing. As Alzheimer's is a progressive disease, the level of care required will increase over time. Here are some key strategies for caregiving. Maintain a structured routine. Keeping a regular schedule helps reduce anxiety and confusion for people with Alzheimer's. Consistent meal times, sleep schedules, and daily routines provide a sense of stability and security. Be patient and communicate clearly. People with Alzheimer's may struggle with language and comprehension. Use simple sentences, maintain eye contact, and be patient when waiting for them to respond. Avoid arguing or correcting them if they make mistakes. Gentle redirection works better. Take care of yourself as a caregiver. Caregiving can be emotionally and physically draining. It is crucial for caregivers to take breaks, seek support from friends and family, and consider joining caregiver support groups. Taking care of one's own mental and physical health is key to being able to care for a loved one effectively. Consider professional care options. As the disease progresses, caregivers may need to consider professional in-home care or even long-term care options such as assisted living or nursing homes. These options can provide specialized care for people with advanced Alzheimer's, allowing the caregiver some respite. Caring for someone with Alzheimer's can be a deeply emotional experience, as it's not just about providing physical care, but also emotional and mental support. The role of a caregiver is a labor of love that requires immense patience, understanding, and compassion. While the road ahead can be challenging, it is also filled with moments of connection, understanding, and love. By focusing on both the patient's and the caregiver's well-being, we can navigate this journey with grace, dignity, and hope. Caring for families and caregivers. Caring for a loved one with Alzheimer's is a unique and often challenging experience, not only for the person with the disease but also for their family and caregivers. It requires patience, understanding, and resilience as the disease progresses and the level of care needed increases. In this section, we'll discuss strategies to help families and caregivers manage the demands of caregiving while also taking care of their own physical and emotional well-being. Creating a supportive and safe environment for the patient. Modify the home for safety. One of the first steps in caregiving is ensuring that the home environment is safe for someone with Alzheimer's. As the disease progresses, patients may experience confusion, disorientation, and even wandering. Simple changes like removing rugs, securing furniture to prevent tipping, and installing grab bars in bathrooms can help prevent accidents. Consider locking doors to prevent wandering and adding nightlights to avoid falls during the night. Use memory aids. For individuals in the early to moderate stages of Alzheimer's, using memory aids can be extremely helpful. Labeling rooms, drawers, and commonly used items around the house can assist in reducing confusion. A dry erase board with important reminders, such as today's date, upcoming events, or the names of family members, can provide a sense of control and independence. Establish a routine. People with Alzheimer's benefit from having a structured daily routine. Knowing what to expect each day can help reduce anxiety and confusion. Regular meal times, bath times, and sleep schedules are essential. Try to keep activities simple and familiar, and encourage the patient to participate in daily tasks within their abilities, such as setting the table or folding laundry, supporting the emotional and mental well-being of the patient. Maintain social engagement. Social isolation can have a negative impact on both the mental and emotional health of individuals with Alzheimer's. Encourage participation in activities with family, friends, or support groups. Attending social gatherings, going for walks, or even simple interactions like playing a game can help the patient feel connected and valued. Even if the person is unable to fully communicate, their presence and interaction with others can have positive effects. Use gentle communication techniques. Alzheimer's can impair the ability to communicate effectively. It's important to approach conversations with patience and understanding. Use simple sentences, speak slowly, and maintain eye contact. If the patient struggles to find words, be patient and give them time. Don't interrupt or correct them, as this can cause frustration. Instead, offer help gently or use nonverbal cues to help them understand. Focus on nonverbal communication. As the disease progresses, verbal communication may become more difficult. At this stage, nonverbal communication becomes increasingly important. Pay attention to the patient's body language, facial expressions, and gestures. Sometimes a simple touch or a smile can convey reassurance and comfort when words are no longer effective. Caregiver support and self-care. Recognize the emotional strain on caregivers. Caring for a loved one with Alzheimer's can be emotionally taxing. As a caregiver, it's important to recognize that you may experience feelings of frustration, sadness, or even guilt. These emotions are natural but should not be ignored. It's okay to feel overwhelmed, and it's crucial to seek support when needed. Take time for yourself. Caregivers often neglect their own needs in the process of caring for others, which can lead to burnout. It's essential to take breaks and make time for yourself. Whether it's engaging in a hobby, exercising, or simply resting, self-care is vital for maintaining your mental and physical health. Remember, you cannot provide the best care for your loved one if you are not taking care of yourself first. Seek support from others. Caregiving doesn't have to be a solitary journey. Reach out to family members, friends, and support groups for assistance. There are also professional caregiving services that can help alleviate some of the physical and emotional burdens of caregiving. Support groups, both in person and online, can provide a safe space to share experiences and receive emotional support. Consider respite care. Respite care provides caregivers with a temporary break while ensuring that the person with Alzheimer's is cared for by a professional. This can be a valuable resource, allowing caregivers to rest, recharge, and attend to their personal needs, knowing that their loved one is in safe hands. Legal and financial planning. Alzheimer's disease can also bring about challenges in terms of legal and financial planning. It's important to start discussions about future care and ensure that legal documents such as power of attorney, healthcare proxies, and wills are in place. Financial planning is also essential, as the cost of long-term care can be significant. Consulting with a financial advisor or attorney who specializes in elder care can help ease the burden of managing these concerns. The emotional journey of caregiving can be deeply challenging, but it's also an opportunity to show compassion, love, and patience. It's important to remember that taking care of yourself is just as vital as taking care of your loved one. Seeking support, recognizing your own emotional needs, and allowing yourself time to recharge are all essential parts of being an effective and compassionate caregiver. Alzheimer's may bring hardship, but it also allows us to demonstrate the depth of our love and commitment to those we care for. By taking care of both the patient and ourselves, we create an environment of hope, strength, and continued connection. Preventing Alzheimer's. While there is no guaranteed way to prevent Alzheimer's disease, research has shown that making certain lifestyle changes can significantly reduce the risk of developing the condition. Taking steps to protect brain health throughout life can help delay the onset or slow the progression of Alzheimer's symptoms. In this section, we'll look at the most effective strategies to reduce the risk of Alzheimer's. Healthy lifestyle choices to protect your brain. Physical activity. Regular physical exercise is one of the most effective ways to protect your brain from Alzheimer's. Exercise increases blood flow to the brain, reduces inflammation, and promotes the growth of new brain cells. Studies have shown that people who engage in regular physical activity, such as walking, swimming, or yoga, have a lower risk of developing Alzheimer's and other forms of dementia. Aim for at least 30 minutes of moderate exercise most days of the week. Healthy diet. the food you eat plays a vital role in brain health. Diets that are rich in antioxidants, omega-3 fatty acids, and essential vitamins and minerals can help protect brain cells and reduce the risk of cognitive decline. The Mediterranean diet, which includes plenty of fruits, vegetables, whole grains, healthy fats, such as olive oil and fish, has been linked to a lower risk of Alzheimer's. Additionally, foods rich in antioxidants, like berries, leafy greens, and nuts, help fight oxidative stress in the brain, which can damage cells over time. Mental stimulation. Just as physical exercise helps keep the body healthy, mental exercise helps keep the brain sharp. Engaging in activities that challenge your mind, such as reading, solving puzzles, learning new skills, or playing musical instruments, can help build cognitive reserve, which makes the brain more resilient to the effects of Alzheimer's. Lifelong learning and mental stimulation are key factors in maintaining cognitive health. Social engagement. Maintaining social connections and engaging in regular social activities are crucial for cognitive health. Social interaction keeps the brain active, reduces stress, and helps prevent feelings of loneliness or isolation, which can contribute to cognitive decline. Engaging with friends, participating in community events, or volunteering can stimulate mental activity and enhance emotional well-being. Good sleep hygiene. Sleep plays a critical role in brain health. Studies have shown that sleep disturbances, particularly poor quality sleep or sleep apnea, can increase the risk of Alzheimer's. During sleep, the brain clears away toxins, including amyloid plaques associated with Alzheimer's disease. Therefore, it's essential to maintain a regular sleep schedule, avoid caffeine and alcohol close to bedtime, and create a relaxing bedtime routine. Aiming for 7 to 9 hours of sleep each night is ideal for brain health. Managing stress. Chronic stress can have a negative impact on both mental and physical health, contributing to the development of Alzheimer's. Learning to manage stress effectively through relaxation techniques, mindfulness, deep breathing, or meditation can help protect the brain. Regular physical activity, social engagement, and pursuing hobbies also help manage stress and improve overall well-being. Controlling heart health. Cardiovascular health is closely linked to brain health. High blood pressure, high cholesterol, and diabetes are all risk factors for Alzheimer's. Managing these conditions through diet, exercise, medication, if necessary, and regular checkups can help reduce the risk of developing Alzheimer's. Maintaining a healthy weight and avoiding smoking are also important steps in protecting both the heart and the brain. While Alzheimer's may feel inevitable at times, we have the power to reduce our risk through lifestyle choices. The changes we make today, whether it's through staying active, eating well, or managing stress, can have a profound impact on our brain health in the future. It's never too early to start adopting these habits. By making small adjustments in our daily lives, we can take proactive steps toward protecting our brains and improving our overall quality of life. The journey to a healthy brain is a lifelong commitment, but with love, care, and dedication, we can set the foundation for a vibrant and fulfilling future. Conclusion and final. As we conclude our discussion on Alzheimer's disease, it's important to reflect on the key points we've covered today. Alzheimer's is a challenging and often heartbreaking condition, but it is also one that we can approach with understanding, compassion, and proactive care. While there is no cure, there are steps we can take to manage the disease, slow its progression, and, most importantly, improve the quality of life for those living with it. Key takeaways. Alzheimer's is not a normal part of aging. It is a progressive disease that affects memory, thinking, and the ability to perform everyday tasks. The earlier we recognize the symptoms, the better we can support and care for those affected. Diagnosis and early intervention are essential. Identifying Alzheimer's early allows for treatments that can help manage symptoms and enables patients and families to plan for the future. Caregiving requires patience, understanding, and love. Alzheimer's is a progressive disease, and caregivers will face increasing challenges as the disease advances. It's important to provide a safe and supportive environment, while also taking care of the caregiver's own mental and physical health. Lifestyle choices can reduce the risk of Alzheimer's. Physical activity, mental stimulation, a healthy diet, social engagement, and stress management all play important roles in maintaining brain health and reducing the risk of cognitive decline. Final thoughts. Alzheimer's disease can be a difficult journey for both the person diagnosed and their family. However, it is important to remember that despite the challenges, we can make a difference. By approaching Alzheimer's with knowledge, compassion, and proactive care, we can create an environment where the person with Alzheimer's continues to feel loved, valued, and supported. The road may be long and difficult, but it is also filled with moments of connection, understanding, and love. For both the patient and their caregivers, the key is to embrace each day with patience, kindness, and a willingness to adapt to the changing needs of the person with Alzheimer's. A message of hope: while Alzheimer's can change many things, one thing remains constant: the love and care we offer to those around us. It is our collective responsibility to help those with Alzheimer's feel seen, heard, and valued. With early detection, the right care, and the unwavering support of family and friends, we can ensure that those with Alzheimer's continue to live with dignity and comfort. Remember, you are not alone. There are resources, support groups, and professionals who can help guide you on this journey. Together, we can make a positive impact on the lives of those affected by Alzheimer's disease. Alzheimer's may be a tough and sometimes overwhelming journey, but it also offers an opportunity to show the depth of our care and compassion. It's in the little moments, the patience, and the love we offer that we can make the biggest difference. By facing this challenge together, patients, caregivers, and families, we can ensure that no one walks this path alone. And most importantly, we can hold on to the hope that, despite the disease, we continue to share love, support, and meaningful connections every single day.